What's the story behind cervical cancer screening's effectiveness? Imagine catching a problem before it becomes serious. That's exactly what cervical cancer screening aims to do. Over the years, screening has proven to be a powerful tool in reducing both the number of women developing cervical cancer and those dying from it. The main reason it works so well is because it helps find abnormal cells or early cancers when treatment can be most effective. The two key tests used are the Pap test and high-risk human papillomavirus testing. The Pap test looks at cervical cells under a microscope to spot any abnormalities, while HPV testing detects the virus responsible for most cervical cancers. Since nearly all cervical cancers are caused by high-risk types of HPV, testing for the virus allows doctors to identify women at higher risk even before any cell changes happen. When screening programs are widely used, they have led to more than a 50% drop in cervical cancer cases and deaths in many developed countries. The guidelines recommend women aged 21 to 29 have a Pap test every 3 years. For women aged 30 to 65, options include a Pap test every 3 years, HPV testing alone every 5 years, or both tests together every 5 years. This approach balances early detection with minimizing unnecessary procedures. The reason this is so effective is because early detection means treatment can prevent cancer from developing or catch it early when it is most treatable. Women diagnosed with early-stage cervical cancer have survival rates of over 90%, whereas late-stage diagnoses have survival rates around 20%. That difference highlights how crucial regular screening is. Despite these benefits, screening rates have dipped during the COVID-19 pandemic, and some groups, especially underserved populations, are less likely to participate. This gap can lead to higher rates of cervical cancer in those communities. Efforts like online appointment scheduling and educational videos are helping to increase participation, especially among older women and those living in rural areas. Besides screening, the HPV vaccine plays a vital role in prevention. When given at the right age, it can prevent about 90% of cervical cancers by protecting against the most common high-risk HPV types. Still, vaccination rates are not as high as they could be, with only about 61% of adolescents fully vaccinated recently. In summary, cervical cancer screening is effective because it finds problems early or even prevents them altogether. Its success depends on making sure women have access to screening and follow guidelines. Combining screening with HPV vaccination offers the best chance to prevent cervical cancer and save lives. Ongoing efforts are needed to close gaps in access and awareness, but the progress made so far shows how powerful early detection and prevention can be. Always remember, talk to your healthcare provider about what screening schedule is best for you and stay informed about the latest recommendations.